A central problem in liver transplantation is that there are not enough deceased grafts available for all the patients in need. Kids pose a unique challenge in donor grafts because of their small size. Living donor liver transplantation is a solution to this problem and allows children to avoid waiting on the UNOS waiting list.
For kids on the UNOS waiting list, 40% will wait over a year for a new liver. Even more shocking, 1 in 10 infants die on the wait list before they get an organ or because they get too sick for transplant. Living donation decreases time to transplant by many months and thus decreases mortality. Additional benefits include ability to time the transplant surgery and optimizes post-transplant survival.
Living donor liver transplant allows a related or even an unrelated healthy adult to donate a piece of their liver to a child with chronic liver disease on the transplant list. The donor has to have a compatible blood type to the child, but in infants this isn't always a requirement. The donor undergoes their own multidisciplinary transplant evaluation to make sure they are physically and mentally a good candidate. Most healthcare expenses related to the organ donation are covered by the recipient's health insurance. So what happens to the donor's liver?
The part of the liver that remains in the donor regrows to 90% of its size and function by just 1 month, and 100% by 4 months post-donation. Similarly, the piece of liver that goes into the recipient regrows to 90% of the appropriate size for the child by 1 month, and remarkably continues to grow with the child for their entire life. Thus, regardless of the donor or recipient's age, the transplanted graft can last the child's entire lifetime. So how do we move the field of living donation forward?
Where only 13% of pediatric liver transplants come from living donors, importantly, access to and awareness of living donor centers is of the utmost importance.
In summary, living donor liver transplant can address organ shortage, decrease waitlist mortality, and improve long-term outcomes of pediatric liver recipients.